On-the-scene video coverage of AHA 2012 is supported by Pradaxa.
One overall impact will certainly depend on what kind of practices the physicians are doing in their group practice, etc. Or overall, it's been estimated to be a minus 2% of impact to their practices. But there are some components that are of concern to the college, particularly in the area of interventions, PCI procedures, and electrophysiological ablation procedures. These unfortunately have been hit again this year. There are new codes for these procedures, and I know CMS has worked with the RUC with their input, but not all the recommendations were followed. And I think PCI has been hit overall by about 20% reduction, and electrophysiology about 25 to 27% reduction, which is of concern to interventional cardiologists. Another area is procedures in the outpatient setting, in the physician office, where you have a multiple procedure reduction of 25% to the technical component of if procedures are done or diagnostic procedures or testing is done the same day. I think this is a major concern to us, that while we are as most efficient as almost you can get in the outpatient setting, also from a cost to Medicare and reimbursement to the physicians, it's really among the lowest things that you can get with all the years of reduction in imaging. This is really of a major concern and causes a major disparity between reimbursement in the physician office versus reimbursement in the hospital setting, where fees are significantly high, not for the physicians but for the technical component. On the positive side, which we applaud CMS for, is a new code and reimbursement for physicians. It's predominantly for primary care, but also for cardiologists upon our insistence to reimburse for coordination of care after discharge. And part of the argument there from cardiologists is that not all physicians are really care coordinated, particularly after a hospitalization by their primary care physician, because if the admission is for an acute myocardial infarction or worsening heart failure or other things that are really specific from a cardiovascular point of view, the initial care coordination is really done by the cardiologist office. And as you know very well, we're pushing for, over the past year and a half, almost 2 years now, the H2H, which is hospital to home, to try to reduce readmissions from their current level of about 25-27% in the country, reduce that significantly, because it can impact not only outcome but also cost of healthcare. And I think this has been a major initiative. So it goes along the line with getting some reimbursement for care coordination after hospitalization. It's difficult at this stage of the game, but certainly we keep trying and emphasizing to CMS and all payers of the importance of quality. And instead of reimbursing pretty much for volume of the care, to figure in that reimbursement parameters for quality and outcome for the physicians. We want to make sure that healthcare is sustainable, not only by all its components, but also the component of the physician and the healthcare professionals that are providing this care. They go through training for 13, 14 years or so after college, and I think this is tremendous involvement there of the physicians to be able to be sustainable in their practices. At the same time, you have significant reductions to various components of their practice. However, their administrative cost and the cost of delivering the care has really gone up and up and up. So we want to make sure that patient access is not suffering, that physicians will stay in practice. Unfortunately, many of these measures will push physicians to an employment model, and the choice is very different. We prefer that to be a choice from the physicians and their patients, as opposed to being pushed by an economic model and not looking at the whole equation with all the stakeholders that are there. So we will keep pushing with persuasive things and getting Congress on our side regarding to understand that, along with many of the other organizations that are hit in the same way.